am a retired registered nurse. I worked for 45 years in healthcare in a hospital, and a lot of those years were spent in the operating room. And that encompasses lifting a lot of equipment, positioning patients, and it results in lifetime injuries to your back. So when I was 30, I ruptured a disc in my back, had to have surgery, a discectomy. And since then, on and off, I've had extreme lower back pain. And I would go to a pain clinic and get pain injections, and they would help temporarily. Since then, I had surgery almost a year ago to have a laminectomy on my right side because I had reached the point where I really couldn't walk. And after that, I experienced until I started coming here, lower back pain on the right side and the left side that was burning and just debilitating. And I didn't want to go anywhere, didn't want to do anything. And luckily for me, I was talking to my surgeon, and he suggested that I try chiropractic medicine, which I had never thought about doing. And so that's when I came here. Before I started coming here, I was in chronic pain. The only time that it didn't hurt is when I was sitting. When I would start to stand up, I was bent over, I couldn't stand up straight. I had bilateral pain, lower excruciating back pain. I didn't want to go anywhere. I didn't want to do anything. It was impacting my husband's happiness. I can't tell you what a difference this clinic has been able to make for me. I was just telling Dr. Matt that on Fridays, which was always my favorite day of the week, we'd go out to eat. We had stopped doing that for at least the last year and a half. We're doing it again. I'm walking. Okay, I feel like a new person. Well, I tried everything, pain management, neurosurgery, epidural pain injections. I do suffer from atrial fibrillation, which luckily is controlled, but because of it, I'm on blood thinners. So I can't just take Aleve and ibuprofen over the counter. I can take Tylenol, but it doesn't really give you the same relief. And of course, you can't take barbiturates and medications that are dangerous for chronic pain. So my choices have been limited. When I came in, Dr. Matt took x-rays and he did an evaluation, and he also has been able to look at my recent MRI, and he came up with a plan, and the plan centers around the Pro Adjuster, which is a computerized instrument that he uses to adjust the spine. And then I go into the stretch table, okay, where actually you can decompress my spine safely. And most of all, the shockwave therapy, which is magical. After one treatment, the pain that I had, that burning, just miserable pain that I had in my lower back, went away after one treatment, and it has not come back. I get a shock treatment every week, and that pain has not come back. You know, I've got my life back. It's absolutely night and day. And I want to say this too, in addition to the curative treatments that you've been able to perform with me, you guys make it such a pleasure to come here. After the first time I came here, I walked in the door, you all knew my name. I mean, you're such a great group of people. So it's a pleasure coming. I've already told all my friends. I have obviously a lot of friends that have spent their career in medicine, nursing, and I've told them all because I have a lot of friends that suffer the same back issues I do. So yeah, I'm the cheerleader here. I'm telling everybody this is the way to go. And like I say, my orthopedic surgeon is the one who sent me in this direction. Right. Now I will admit that I chose your clinic because you had a 5-star rating. I read the reviews, so it was just, a given that I would come here, and I live 10 minutes away, so that helps too.